Hi, my name is Ashton Verdery, and I'm an Associate Professor of Sociology and Demography at the Pennsylvania State University. I'm here today to talk about a critical component of social networks and health research, and that is the role that family and kinship networks play. The thesis of my talk is that the social networks literature tends to emphasize friend and affiliation networks and to somewhat de-emphasize family networks and kinship networks, even though the latter are central components of social organization and play a massive role in influencing individuals' health, particularly at certain developmental stages. This insight was well known in early scholarship on social networks, including work, for instance, on the historical social networks linking individuals in historical Florence, in the Florentine family sociogram shown here, for instance. But to some extent, as modeling tools for studying friendship and affiliation networks have become more readily available, I think that some of the emphasis on family networks was lost in the social networks literature and could do for greater attention in the future. As such, in my talk, I hope to give a general kind of orientation to some of the work that I've been thinking on as a way to begin to consider social networks and health research and to emphasize what are the network ties that link people across place. I'll talk a little bit about classic theories and contemporary theories about the role of family networks, and then I will talk a little bit about empirical evidence regarding the importance of family ties in individuals' lives. After that, I plan to turn to what I view as some critical open questions in family networks research, including things that survey data are well situated to address and things that survey data are not well situated to address. In each of those, I hope to give several examples from my own research or research of others to discuss the opportunities that are available. Then I will turn in a little bit more depth to some of the non-survey approaches and methodological tools that are available for studying this, including microsimulation analyses, data fusion approaches, or analytic efforts. And then I will conclude with some resource presentation and some final thoughts. Much of my research lately has been focused on the issue of disasters and how disasters create both a ring of kind of major disruption in a localized way, as well as a ring of more lesser disruption. And of course, people are situated throughout this space. There are individuals that are heavily impacted by the kind of major disruption areas, as well as individuals that are impacted in sort of a lesser kind of fashion. And then beyond that, there are people who are maybe not so directly impacted at all. But those individuals, of course, the major idea of social network scholarship is that those individuals are connected to one another through networks. And what's been interesting to me is thinking through how individuals that are in the ring of major disruption or heavily affected themselves, for instance, people who might die in a global pandemic, are influencing those to whom they are connected. Those individuals to whom they are connected might be someone who got sick from the pandemic themselves but didn't pass away, but they lost their spouse to it. Or they might be someone outside of the ring of lesser disruption and intimately tied to those who are in the ring. And a lot of my scholarship lately has been focused on this issue. One of the central questions, however, is what are the ties that define such impacts? I think the social networks literature often emphasizes this kind of affiliation or friendship ties and de-emphasizes family ties. But in the examples that I gave earlier about disasters, I think it's quite clear that family ties are some of the most consequential ways that we are connected to one another across space, across time, and other things. And my take, or some of the challenges that I see in the literature, is that the social network literature tends to privilege friend and affiliation ties over kinship and family network ties, at least as a point of emphasis. And I don't think that there are good reasons for doing so. In fact, I think that theoretically, as well as empirically, there are very good reasons to pay much more attention to family and kinship ties. I do, however, note that there are some methodological reasons that make studying friendship and affiliation ties particularly compelling, owing to rapid advancements in the ability to model dependent kind of network formation, for instance, through tools such as exponential random graph modeling. Despite those kind of methodological opportunities, however, I think that the neglected ties, the family and kinship ties, are actually more important for many aspects of our lives, or at least many of the things that I'm studying, I've found that they are incredibly consequential for individuals. To kind of discuss the scholarship and a neglect in the scholarship on social networks is a bit challenging, because how do you pin down all of the studies and what they are actually looking at in terms of their networks? But I can look at the Web of Science kind of database of academic research and look at what they classify as being on the topic of social networks. And they find in that classification scheme about 75,000 articles are kind of in a social networks topic. And only 8% of those 75,000 articles also are studies of family or kinship. So I think in general, when we discuss social networks, we often are thinking of kind of these affiliation networks and neglecting this central role that family and kinship networks play within it. And I think that this is a major oversight in the literature. Now, someone might ask, well, maybe that's just all of the social networks research, and we know a lot of physicists study this, a lot of computer scientists, etc., and maybe the more social science efforts or emphases on social networks research would better capture family or kinship networks. And I actually thought that could be the case, and I thought, well, what I will do is I'll look at the journal Social Networks, which is sort of the premier social science journal for social network analysis research. And in that journal, according to Web of Science, there are about 1,400 articles published since the 1970s. And I thought that there would be a much larger percentage of those that study family or kinship within that. But actually, it's about the same. It's about 9%. In general, the field shows a growth in this kind of family and kinship network studies from almost none throughout the 1980s to about 10%, sort of starting after the 1990s. But I think that there's still substantial room for continued growth. The early research on the social networks literature, I think, was attempting to differentiate itself from kind of family-based research. And so in some ways, it makes a lot of sense that in the 70s and 80s, there was considerably less research on family and kinship networks in the Social Networks Journal. But I think that even though it has grown over time, it has been relatively stable for the last 20 years. And there's still kind of room for it to have greater emphasis on family and kinship networks. How do we get here? I think that a lot of classic social network scholarship actually did look at families and kinship networks. For instance, I mentioned the Paget-Florentine families study earlier, but we can look at other ones as well, as Loomis's early work on kind of informal groupings in a village and the kind of organization of people's homes and visiting relations as they are structured by social ties between individuals. Or we can look at Bott's classic treatise on family and social networks and the central role that families played in kind of structuring social networks in different environments. There were also classic traditions that were quite complementary in anthropology, sociology, developmental psychology, and demography that focused on the kind of roles of family and kinship ties in kind of social, in the creation and maintenance of social structure. This would include work by Levi-Strauss and others, as well as some of the central roles that kind of family networks created in terms of people's orientation, their kind of life circumstances, and their relations to one another. And early work in demography emphasized the role of family networks in transmitting kind of behaviors, the likelihood of migration or fertility diffusion behaviors, and how those were structured heavily by kind of family networks. But despite that kind of classic tradition emphasizing family and kinship networks, there was a sort of parallel tradition emphasizing affiliation networks. And one of the classic first studies of social networks is the sociometry proposed by Moreno, who studied various kind of circumstances in which family networks might be less relevant, including classrooms or psychiatric facilities. And that work really, I think, has captivated the social networks literature in a way that has led to a downplaying of family and kinship networks. Despite the fact that family and kinship networks are somewhat downplayed in the social networks and health scholarship, I think that this is actually a major issue because we're ignoring the central role that family ties play in structuring social networks. Families are some of the most central components of many classic network findings, in particular when we think about how they relate to health. Because of the recent news about abortion in the United States, I was thinking about the classic study of searching for an abortionist before Roe v. Wade. This is the case where individuals would go and they would search to try and figure out how they could find an abortion while it was illegal. And we would think that these kind of ties, to find information, a classic network theory would be that you'd search your network in the most, try and find the most diverse sources of information for it. But the scholarship on searching for an abortion found that over half of searchers initially asked, the first person they asked for help finding an abortionist was a family member. So this kind of counteracts some of the classic theories about how you would efficiently search for information in a network. Other work, for instance, important scholarship on the role of social isolation in the United States and its potential for growth, starting with Marsden's work as well as McPherson and Lynn Smith-Levin's work, has emphasized that there have been massive changes in people's networks. But one of the things that I think is underplayed in a lot of that scholarship is that almost 2/3 or even more than 2/3 of people nominate more family members in their network than non-family members as kind of close confidants. And then the last study that I wanted to bring up as a key point of emphasis and where this graph is drawn from is the series of studies that I think broke social networks and health research out into a much wider audience, which came from Nicholas Christakis and James Fowler's work on the Framingham Heart Study, where they asked individuals, they used an existing data set of people's health collected over a long period of time, and they built a social network from the close contact information in that survey. And this study led to a number of very prominently regarded papers about the potential for the spread of obesity in social networks, to the potential for the spread of loneliness and happiness and other aspects in people's social networks. But one of the things that was, I think, generally neglected by many scholars of this is that that network is, the majority of ties in that network are family and kinship ties, not friend ties. These are ties that are people who would be able to refer you or find you if you were to be lost to follow up in the study. That's how they constructed the network. And many of the people that individuals nominated are close family members, which clearly gives a different perspective on the potential for the transmission of, say, obesity in the network than would be the case if it was just a purely affiliational network. Even other research that doesn't focus on health-related aspects, since, for instance, the classic Small World experiments by Milgram, where he asked individuals to send letters from individuals in Kansas to send letters to a random person in Boston. We would think that, again, the classic network theory would predict the most efficient way to kind of navigate the network would be to go through more diverse ties. But over 14% of the ties in that, of the letters in that experiment were sent through family members, suggesting that people, even though the classic way to explore this would be through very weak ties, were also searching through their strong ties in order to find an individual. And even other work about emphasizing the strength of weak ties, or the ways that weak ties help us to find jobs. I think that work is well known for suggesting that we should network with our kind of weaker ties to get more information in our networks, but that those network ties are more likely to lead to getting jobs. But despite the importance of weak ties for kind of finding out information, over a third, or about a third of the ties in that kind of classic Granovetter study of the strength of weak ties actually led to jobs being found through family members, suggesting that there is a central role even in these aspects for kind of strong ties to influence our lives. Circling back to some classic theoretical ideas, I think that I want to emphasize three primary areas that are relevant to the kind of family networks literature. The first is the idea of social support, which is the set of material and non-material resources that we perceive available to us or actually use that can be accessed through our social networks. The second is this idea of roles, and a role is a normative set of rights, obligations, and proscriptions on what you can do that are embedded within a relationship and defined by relative positions in social space, and of course that are moderated by the available resources that you could give or that you might require. And the third is this classic family network scholarship idea of a convoy, not like a trucker convoy, but the convoy of people that stay with us throughout our lives and potentially move in and out of different levels of closeness to us and play different roles for us at different time points. Convoys are defined as the personal network in which support is given and received, and is generally thought to be this kind of an effort to think of social networks dynamically throughout the life course and how they might change. And I think the convoy concept is very fascinating because it aligns with a lot of classic social networks ideas about kind of different social circles that we have of different levels of proximity. The convoy concept emphasizes that there are people that are in a very close circle to us, that include close family members, and people can move in and out of those over different points in our lives. For instance, our parents might move from the very close convoy when we're children to being a little bit further apart when we're in young adulthood, to being close again after individuals have children, for instance. As well as people in a kind of larger circle of friends, and then an even more diffuse circle of kind of acquaintances and coworkers and things like that. And a lot of the recent theoretical advances in the social networks literature, I think, pertain directly to thinking about the role of strong ties and family ties in our social lives. I think that there's a renewed emphasis on the importance of strong ties for social relations. For instance, work by Damon Centola and Michael Macy, as well as follow-up work by Damon Centola, has emphasized the role of complex contagion and the ways that it might differ from simple contagion. The idea here is that health behaviors and other information doesn't simply spread through processes like infectious diseases or like the flu or something like that. They must spread through different social patterns. And one that was proposed is this idea that they spread through you're more likely to adopt a complex phenomenon like a health behavior if multiple people around you have adopted it. So you don't just need to be introduced to it by one source. You need multiple sources to introduce you to it. And when you look at networks and diffusion processes that are defined by complex contagion compared to simple contagion, you get very different dynamics on the network, suggesting that there are real reasons to be paying attention to the important role of strong ties. Another recent paper that I found to be groundbreaking in its emphasis is this idea of the diversity bandwidth trade-off that plays into how information transmits through networks. The idea proposed by Sinan Aral and Marshall Van Alstyne is that even though a classic network theory emphasizes that we get the most diverse information and often the most useful information through kind of weak ties or ties that are non-redundant in our social networks, we still get a substantial amount of important information through ties that have very high bandwidth and are characterized by high levels of trusting the information source, high levels of communication frequency, high levels of knowledge of specifically what that person is able to provide that could help us to understand what we might ask for from them. And Aral and Van Alstyne suggest that really what happens is that very high bandwidth ties tend to generally have low diversity, and so they might not present as much novel information to us, but because of the sheer volume of information they transmit, we end up with quite a bit of novel information, even though the kind of refresh rate of information tends to be a little bit low. Whereas highly diverse ties or low bandwidth ties, they don't transmit as much information, but each piece of information they transmit is more novel. And so in the end, we sort of end up with both ways yield, both strong ties and weak ties yield great amounts of novel information for us. So thinking about social networks in the life course, I wanted to kind of talk through some of the empirical evidence about the role of family networks. These two graphs, I couldn't decide which one made more sense to show, so I decided to show both. These two graphs both plot data from the American Time Use Survey. On the left, it shows kind of the average number of minutes that people in the United States report spending with different types of kind of social relations. And you can see that at younger ages, we spend more time with our parents, for instance. At older ages, more time with our spouse, and in sort of the middle adult years, much more time with children or coworkers. And the graph on the right, stacks all of these minutes up. And to some extent, it's imperfect because these are not necessarily mutually exclusive. We could spend time with both our spouse and our children, for instance. But I think despite those problems with stacking them, it really does convey the central role that family networks play in organizing our lives. Keeping in mind that there's probably about 900 minutes that people are awake every day, you can see that in the kind of middle ages, we're spending substantial amounts of time with other individuals, and then younger ages a little bit more time alone, and at older ages more time alone. But the critical kind of insight from this graph, in my opinion, is that family ties play a vast majority of the amount of time that we're spending with other people. They're very, very high bandwidth ties. and they have a great capacity to transmit large amounts of information or large amounts of influence. And this is particularly true at certain developmental stages. For instance, in young adulthood and childhood, we spend the vast majority of time that individuals spend are with family members. And especially in older adulthood, especially in the 60s, 70s, 80s, the vast majority of time that individuals are spending are not with coworkers, not with friends, but with spouses, children, and other family members. And this plays a central role in kind of people's lives. Other scholarship also suggests that family ties are particularly important, especially at certain developmental stages. Research on who people turn to when they have important matters to discuss, as plotted here by 10-year age groups, suggests that throughout from the 1980s to today, family ties are incredibly important sources of information. There's a lot of debate about changes in numbers of friend ties, but you can see here that the family tie numbers are relatively constant throughout the survey period, and that in older adulthood, particularly as people go beyond age 50, family ties play a very central role in individuals' daily kind of discussions and who they speak to. To drive the point home still further, I wanted to look at some scholarship on who we turn to or who we perceive that we could turn to for help if we needed help fixing problems, if we needed small loans, etc. And no matter what outcome you look at almost every life stage, the people that individuals say they could turn to the most and they would get the most support from are their family and kinship relations. And this is true at young ages and at older ages, but in the middle kind of ages of life, it might be a little bit less of a distinction, but particularly at certain developmental stages, family and kinship networks play a very central role in organizing social support relations. The flip side of all of this is that roles are not just sources of opportunity for us, but they're also a set of obligations. And these obligations fall on individuals differently at different life stages. In the United States, for instance, the graph here shows U.S. attitudes about who should help older adults as they're older and need help. And the vast majority of Americans believe that these helping relations should fall primarily on family members, and they should have a strong component of help. This obligation is going to fall on particular life stages, and this creates all sorts of challenges. For instance, the classic studies about the idea of a sandwich generation, or individuals who are sort of in their midlife taking care of small children as well as taking care of elderly parents, and that these kind of burdens can be quite stressful and deeply influence people's health. So it's not just the receipt of social support that helps us at different life stages, but it's also the obligations to provide it, which can cause stress at different life stages that influence individuals' health. American ideas about this are not exceptional or otherwise atypical throughout the world. In fact, perhaps we might even have a smaller emphasis on family ties. Here I wanted to show that in China, for instance, some of these expectations of filial obligation are even codified into laws. In the 1990s, China passed a law emphasizing that the expected people to care for elderly parents are young children, are their children, and that, in fact, older adults who feel that their children are not supporting them in their old age can even sue their children for alimony to help them to succeed and thrive in their older adult years. So these ideas that who we help vary across society, who's supposed to help older adults, who's supposed to help young children, varies across society, but that there, in many places, there's heavy emphasis on this. In the United States, it's the vast majority expectation. In China, it's even codified into laws, and throughout the world, these ideas are central. These burdens do change over the life course in terms of who we would support, but it's also important to recognize that they are changing over time. When China implemented this idea that family members are legally obligated to care for older adults, for instance, there was a much smaller proportion of individuals in their kind of middle adult years that have older adult living parents. But that proportion is rising very rapidly, and is expected to continue rising in the coming decades, suggesting that there's going to be increased demands for financial support and caregiving for older adults in China that might upend some of the capacity of the society to deal with the population aging and this these expectations of who's providing support and care. This is not just the case in China, but this is one illustrative example of it. Now I wanted to turn to what I view as some open research questions about family networks and health that could be answered with survey data. And I think that even though the thesis of my talk is that the social networks literature could learn a lot from the family networks literature, I think that the reverse is true as well. And I think that there are really important questions in the family literature that social networks scholarship could better help us understand. Areas that I think are key questions are: what are the general structure of relevant support networks? What are people's expectations for giving and receiving support? How do those expectations align with the actual giving and receiving of support? And how does that vary across time, across developmental stages, and across different population subgroups? I think that there's substantial room for growth in studying this, and that some of the network tools that have been developed for studying affiliation networks could be well employed to study some of these concepts. For instance, the convoy model that I emphasized earlier suggests that the social network of people who provide social support to us is important throughout our lives, but to some extent that sort of selects on a dependent variable, and it focuses on this network of provision and receipt of support without acknowledging that there might be a larger network of individuals who are able to provide support. This is an issue that I've found in my own scholarship with my colleague Jonathan Daw, where we have a number of studies where we are looking at kidney transplant candidates and their likelihood of obtaining a kidney transplant. In that kidney transplantation literature, there's a heavy emphasis on what we call the differential access hypothesis, which is this idea that Black Americans and other minority groups might have lower rates of kidney transplantation, which they have substantially lower rates, that the reason for that lower rate compared to non-Hispanic white individuals might be because they have fewer healthy and willing members of their social network who could give them kidneys. And that scholarship is primarily based on clinical studies where they examine who comes into the clinic and is evaluated for kidney transplantation. That clinical-based study suggests that Black Americans have fewer people show up to be evaluated for kidney transplantation, and those who do show up tend to have greater levels of disqualification owing to health conditions and structural racism that lead to greater problems in individuals' health. But what we decided to do when we studied this is to recruit a large sample of individuals and say, okay, well, it's not just who shows up at the clinic to potentially be evaluated to provide a kidney. It's not just the convoy of people that are providing and receiving support, but it's also the network of people who could provide or receive support. And so we conducted a series of studies with network rosters where we asked Black and white Americans to enumerate their social networks and family and kinship networks in a way that we could learn, are those people likely to be healthy? Are they likely to be willing to donate a kidney? And we looked at this both from the perspective of patients as well as surveying the network members themselves. And no matter how we look at it, we find that actually the differential access hypothesis is not particularly well supported, and that Black and white Americans have roughly equal numbers of potentially healthy individuals in their social networks. The graph here shows the proportion with one or more suitable donors in individuals' networks, but we can look at the average numbers of donors, we can look at all sorts of different measures and find roughly the same kind of conclusion, that Black and white Americans have generally about equal rates of access, suggesting that other aspects might be leading to disparities in kidney donation rates, including other issues like medical system mistrust, lack of access to resources to support giving a kidney donation, and other things. I also think there's substantial room for growth through studying longitudinal prospective cohort study designs. Much of the family networks literature, I think, has neglected to examine networks over time and the ways that those changes over time might influence individuals. So in a series of projects with colleagues Huijing Wu and Rachel Margolis, we are looking at individuals' reports of who they say they expect to get help from. And what we find is that individuals who are younger say that they expect to get more help when they're older than individuals who are older, and also that there's a great increase across cohorts in the levels of people saying that they expect to get help from family and kinship network members. Overall, people generally report that they expect their children or their spouse to be able to help them, or that they'll have a family member who can help them in their older adult years when they face kind of difficulties with activities of daily living. And what we are doing in this project is looking at these kind of cohort changes in expectations, as well as cohort changes in the capacity of networks to meet those expectations. And what we find is that while people's expectations are increasing over time, their number of family members who could meet those expectations is declining quite precipitously. And in a series of projects, we are looking at what happens to individuals as they begin to actually experience these problems. Who are they actually turning to? And we're finding substantial gaps are emerging. And so I think there's a lot of room for longitudinal prospective cohort study designs to better understand these factors. In another series of projects with colleagues Emily Smith Greenaway, Michelle Livings, and others, we are looking at the ways that family and social networks might mediate one another and mediate the influence that they have on individuals. A series of projects that I've worked on is related to bereavement and the idea that when you lose a close relative, it affects your health and well-being. And one of the things in that literature that has not historically been studied, but I think is an opportunity for understanding and bringing in some social networks concepts like the idea of embeddedness, is that the death of one family member doesn't just affect you, but it affects those around you as well. And so what we looked at in this particular paper that just came out in Social Science and Medicine is how grandmothers' deaths influence adolescent kind of depression rates. And what we find is that what we wanted to test was whether the grandmother's death influences adolescent depression directly through kind of the depression of the adolescent, or whether it's potentially mediated by an influence on the mother's depression. So that if losing your grandmother is particularly consequential for your mother, that might be a source of the ways that grandmother depression influences individuals' health. And what we found in this particular case is that actually almost all of the relationship is a direct effect, not through the indirect path of maternal depression. But I think that there's a lot more that could be done in the family networks literature, looking at the potential for mediation and moderation, and thinking through how kind of networks are not just dyadic relationships, but are a set of individuals that are connected to one another as well as to you. I also think there's a lot of room for growth in incorporating more causal inference approaches. In a project with my postdoc Hao-Wei Wang and others, we are looking at the idea of whether losing a loved one to COVID-19 is worse for your health than losing a loved one to other causes. And so what we look at here is we use a very unique survey that was in the field when COVID-19 occurred, and about half the sample was collected before COVID-19, half was collected after COVID-19. And we were able to separate, did you lose a spouse in the prior 3 months from that kind of pre-sample for reasons other than COVID-19, not during a pandemic, compared to did you lose a spouse to COVID-19 during the pandemic period. And we can look at, through kind of the use of a difference in difference approach, we can look at what would be the counterfactual expectation for rates of depression or loneliness or other mental health problems that individuals face from this bereavement event. And we know that bereavement is very bad for people's mental health, for their perceptions of loneliness, etc. But what we don't know is whether particular types of death, in this case these pandemic deaths, lead to elevated rates of depression or of depression and loneliness, etc., following from bereavement. And what we find is that it is substantially elevated after this event. And I think that this is a nice project because it also highlights the role that certain types of death circumstances have for influencing people's mental health following bereavement in a way that speaks more generally to more general processes beyond the pandemic. Last, I wanted to talk through the opportunities that exist for growth in the kind of family networks literature through intervening and creating network interventions that target family relationships. There's a lot of emphasis in the social networks literature on the development of network interventions, but I think some of those efforts neglect the central role that families play. And so turning back to those kidney transplant candidates with my colleague Jonathan Daw, we are running a large clinical trial. It's in the field right now. I think we have like 50 people enrolled so far, 50 kidney transplant candidates enrolled so far at multiple sites. And we are randomizing people into different arms of the study. One arm is that we coach people on how to efficiently navigate their social networks to have these conversations about kidney donation. One of the challenges that we've observed in qualitative and pre-testing data is that people tend to approach one or two family members if they are evaluated and they're turned down by those individuals. And the person who's evaluated is rejected for being medically unfit, that they don't continue to then ask other individuals. And so what we wanted to do is to give people the highest likelihood of having a network member who's likely to agree and likely to be medically evaluated as suitable to donate. So we have one condition that uses the family network rosters that we gather from people to kind of use genetic and likely health condition techniques to kind of sort people into tiers in order to better understand, or to give people a kind of a set of people to approach in a certain order that might increase their likelihood of obtaining a living kidney donation. Another arm of the intervention is that we give people different kind of talking points to raise with family members to help them better understand how to initiate these conversations, because many people, particularly people from racial and ethnic minority backgrounds, found reported in preliminary work that it was very difficult to initiate these conversations. And so these intervention efforts are going, we have a follow-up in several years where we're looking at whether these individuals actually obtained a kidney transplantation, who they obtained them from, and we're going to see whether we can kind of successfully leverage the family networks to better understand and increase rates of kidney donation for these individuals who otherwise will die without a kidney transplantation. I think that there are a number of other open research questions that can be addressed with non-survey approaches, but that these have received a little bit less attention in the literature. For instance, one question that can't really be addressed well with survey data is how networks are changing across the life course. This can't be addressed with survey data because there are very few sources that have been running long enough to really track it. There's always questions among those that have been running for a long time of whether they're representative of the population, and then it's difficult to disentangle issues related to age and period and cohort in any sort of survey data about this. Another question that sort of flips the age question on its head is how have changes within a specific age group changed over time? Again, this has a lot of the same problems that there's just not enough long-run data on social networks to be able to tackle this, even though there are really important questions that are raised by substantial amounts of kind of speculation and theoretical conjecture. Another problem with any sort of question about how have changes over time unfolded is that I think that one thing that is broadly interesting is, and for policy relevance, is what the future might look like in these regards. But many of the existing sources have no window into the future. And so I think that kind of understanding family and kinship network change in the future is a critical area to understand the potential burdens that might arise from mass population aging, for instance. Last, I think there are a number of questions about what structures transitions in people's networks. And here I'm thinking of a lot of the scholarship that I've done on the issues of, for instance, bereavement. And one of the problems with studying something like this is that even though everyone throughout their lives is going to lose a close family member to bereavement, at any individual time or to any particular cause, the proportion of the population that loses someone to a specific cause of death is going to be kind of low. And so we actually end up with a lot of rare events influencing rare events, and survey data is just never well suited to slice and dice itself that way. There are a number of approaches out there that I'm going to discuss in the coming slides to try and understand these types of things. These include kind of microsimulation models. What I'm going to kind of group broadly within what I consider like a data fusion approach, where you use data from multiple sources. And then there's kind of emerging analytic and computational approaches to understand these as well, which I think hold substantial promise. To give an example, one of the questions that I think is broadly relevant is how are family networks changing over the life course? And one of the things that I've done to look at this was using demographic microsimulation data for China. One of the questions that I think is fascinating in China is how is the one-child policy going to influence the number of cousins? Eventually, we would expect that the number of cousins would decline owing to people only having one sibling, but how quickly is that actually happening? And how might that influence Chinese social structure? To do this with demographic microsimulation approaches, the idea is that you would use both historical and projected rates, and you create individual computer agents who then marry, give birth, divorce from one another, die, etc. And then through simulating these individuals over a long period of time, simulating the society operating for a long period of time, we can track progress and examine kinship networks. Of course, this isn't just a mathematical exercise. I think that there's a scientific basis for it, and there's a lot of emphasis in the kind of microsimulation literature on trying to calibrate the particular rates that you put in. For instance, you might need to adjust for the percent of the population that's childlessness, as well as to kind of validate the data against what exists. And one of the things that I've done is validating some of these microsimulation approaches against survey data. But the upshot of all of this is that we can examine the structure of networks at different points in time and how they change over the life course. And I think that these are really interesting results that are, they're still, they're estimates, so they're accurate only to the extent that our assumptions are correct. But I think that they can point to important policy kind of challenges. For instance, here you can see this rapid growth in China's proportion of the population in the next 40 years with very few living cousins. And we can see that change throughout both time periods as well as throughout the life course. These are two population pyramids. The one on the left, labeled 2010, shows the population in 2010, where going vertically along the axis is getting older, and then it shows numbers of men on the left and numbers of women on the right. And the different numbers of people with different numbers of cousins are sort of shaded. And you can see most of the population has a large number of cousins in 2010, but that by 2050, a substantial proportion of the population, particularly concentrated in younger individuals, will have no living cousins, which is a very rapid shift, almost like a phase transition type of shift in the society over a 40-year period that the ramifications of which have not been fully understood. We can also examine networks over the life course over time. And I think that one thing that is phenomenal about these demographic microsimulation approaches is not just that we can examine where in the life course we're expecting to have different numbers of family members, but also how that might change over time. And so looking at one particular cohort of individuals at different kind of ages, we can see this rapid increase in their numbers of cousins at different times over time. And we can see that there's a real bloom in the numbers of cousins just today that the kind of average adult has in the society. And we can think about how that might influence social relations. We can actually add all of these kind of things together and look at not just cousins, but all sorts of different kind of kinship relations, and examine how Chinese society and other societies might have changed through kind of kinship connectivity. And there's a classic narrative in both the demographic and kind of sociological literature that historical societies were heavily kin dependent. There was this extreme density of kin ties. But what we find, and what I found in a number of projects in different societies at different points in time, is that really many places the density of kin relations is actually much higher today than it historically has been, owing to the demographic transition and the ways that decreases in mortality created the opportunity to have much larger extended family networks, and how that current situation that we're in, where the family networks today are much more dense than they historically were, is actually going to change rapidly over the next century as low fertility begins to take its toll. And you can see here, this massive increase in kind of family networks in China in the last 30, 40 years, and the next 30 or 40 years, a massive change and decline in family networks. China is not the only society that faces these changes, and the rapidity of these changes might be surprising in some ways. One project that I've looked at is the rapid rise of older adults in the United States who have no close family members, partners or spouses, children, biological or otherwise, and siblings and other types of relation. And what I found in that project is that there's going to be rapid growth in the proportion of the population who has no close family members who are older adults, and that growth is going to be unequally distributed by race. There's also a series of projects on what I consider like an imputation or data fusion approach. And I think that there's a lot of room for kind of clever growth, clever analyses to make important contributions to critical questions about how society is operating here, and that this is an opportunity for a lot of potential growth. To give an example of this effort, I turned to my colleague Jonathan Dawes' work on, again, kidney transplant candidates. And I reported earlier that we have a study in the field where we collected data, where we enumerated the full networks of kidney transplant candidates of Black and white Americans at a couple different research sites, and found that there was no real difference in differential access. But actually, my colleague JD had published a paper about 8 years ago suggesting that this was likely to be the case in empirical data, despite the clinical data, because he used a imputation data fusion approach. And to do that, he took kind of the attributes of people who are on the kidney transplant waiting list, merged those attributes to like expected family networks for those individuals derived from the panel study of income dynamics, and merged from the National Health, the NHANES study, merged kind of expected health profiles of those network members, and computed the likelihood that individuals have at least one or the number of kind of family members that they might have who are likely to be good donors for them. And what he found in that project is that there isn't a differential access through this data fusion approach. And so I think that this is kind of the opportunities that are available through kind of merging multiple data sets and being clear about the assumptions that you're making when merging those data sets really can shed light on the ways that family networks might structure individuals' relations over time. I also wanted to give an example from some of my ongoing research about the COVID bereavement crisis, and thinking through how these efforts can teach us what structures transitions, and bereavement being one of these major life transitions, one of the transitions in our social networks that most heavily affects our mental health. And one of the things that I found very interesting is that early in the pandemic period, there was a lot of emphasis on, who cares about the people who die? They're about to die anyway. And I was curious about, well, that doesn't, seem reasonable to me. Any death is generally a tragedy. And so I wanted to kind of enumerate, like, what is the likely number of people that would be left behind by each COVID death? And I began this project in March of 2020. And at that time, one of the biggest challenges is that there was no real-time tracking data to be able to examine this, and the pandemic was nascent, so only a couple thousand people had died at that point, and it wasn't clear what is the likely kind of ripple effects of this on society. In addition, a lot of the research on this is sort of biased by what I consider poor research questions for trying to understand this. And they would ask people, there were some Gallup polls and things that would say like, oh, do you know anyone that died of COVID-19? And people would say, 30% of people would say yes, even though only 1,000 people in the United States at that point had died of COVID-19. And I think that the problem with this is just, classic network research designs would suggest it's not a good way to ask that sort of question, because people will think of everyone that they've ever heard of to find one case who might die, even though if you'd ask them, who are you close to, who do you interact with, etc., their network, and enumerated their network, and then asked of those people who died, you would get a very different answer. And so I was interested in trying to understand this issue. And as I said, many of the early kind of narratives about COVID-19 were emphasizing this idea, well, these people are going to die in a short order, and maybe that they're less socially connected, that they're not individuals who have close relatives or things like that. And I was curious, like, that didn't seem to be a likely scenario, so I was curious to estimate this. To do this, I used what I consider kind of an imputation data fusion approach, and some of the existing microsimulation data that I discussed earlier, where I was the microsimulation data where we projected the number of Americans without close family members. Through that, we had done a series of calibration and validation exercises to try and see, does this accurately represent U.S. kinship networks? And in large part, we believe that it does. And so we could use the kind of existing kinship networks for 2021, 2020 in the United States to simulate a infection situation on those networks. We tried a number of different infection scenarios, like mostly middle-aged people get infected, mostly older adults get infected, etc., and then conditional on infection, whether the individual dies. And then in those simulation exercises, we could then track, what is the proportion of people who lose a loved one. And what we found is that because of the very steep age gradient of infection fatality rates from COVID-19, because of the steep gradient of kinship network ties, and because of the likely situation that COVID-19 was going to infect a large proportion of the population, we found that pretty much under a variety of different circumstances, there was a relatively constant answer, which is that the average number of people that would be left behind from each COVID-19 death was about 9. And we found that these deaths were concentrated at different points in the life course, and the relationship to the person who died varied at different times, but that on average about 9 individuals would be bereaved for each COVID-19 death. And there's different kinds of relationships to those who die. This has been, I think, a pretty influential study because we have provided a tool that researchers and policymakers and others can use to estimate the kind of dynamic size of the U.S. bereaved population from COVID-19. And as the pandemic has unfolded, the bereaved population has increased quite dramatically and substantially larger than the number of people who died from COVID-19, suggesting that, when we think of these disasters, the ring of major disruption extends far beyond just those who are hit in the ring of major disruption to those that they are tied to. This work also led us to being some of the first to diagnose or recognize or sound the alarm on the very large number of children who have lost, who are expected to lose parents to the disease, because even though a small number of children are bereaved for each COVID-19 death, when you have thousands and hundreds of thousands and now even 1 million deaths, even a small number multiplied by that yields a very large number of children. And so we published an early paper recognizing that about 40,000 children had lost a parent to COVID-19 at that point, and that this was a crisis. And that paper really kind of ricocheted around the world, and the only quote I could find here was from Liana Wen, but I was so flattered when the U.S. Surgeon General kind of tweeted about our study, and it really, I think, raised attention to an underappreciated aspect of the COVID-19 crisis, which is that these deaths are influencing people of all ages. This study was also recognized. I was very proud that it was recognized in this year's 2022 or 2021 Stat Madness kind of tournament challenge, where they created, the Stat magazine, which is a science and medical news magazine, created a bracket and had people vote on the most influential studies of 2021. And we actually finished in the final 4, which is something I'm very proud of. And I'm also proud because our results, I think, have been borne out and redirected policy attention to some existing issues. One of the existing issues is that only about half of children who are eligible to receive Social Security survivor benefits in the United States actually receive those benefits. And our study pointed, to that challenge and I think kind of galvanized a little bit of effort to kind of increase those rates. And then subsequent Social Security data that came out after our study was released suggested that our estimates are probably in the right ballpark, because the increase over the period that we were studying was about 21,000 people, which multiplied by 2 because of the 50% receiving benefits puts it in the ballpark of our study. Another example that I wanted to talk about of family and kinship networks is how the population will change over time. And one of the things that I'm working on with Malika Snyder and people at the Max Planck Institute of Demographic Research is how long will the individuals who were bereaved by COVID-19 persist in the population, and how might different populations experience different rates of change in that proportion of the population that was bereaved from COVID-19. And we look at different kin types as well as different countries. Here I'm just graphing a few of the countries, but we have a host of different countries that we can look at to kind of understand how the breadth of the impact, the age structure of the impact, and the rate of population change in those countries is influencing the sort of bereaved population, or who might remember individuals who died from COVID-19. There are a number of resources for conducting family networks research that I think should be attended to. A number of survey sources are really great places to look at this, and some of the ones that I've used in my research, although there's many others, include like the Panel Study of Income Dynamics, the Health and Retirement Survey, the Survey of Health, Aging, and Retirement in Europe, which is particularly unique because it has both an extensive social network enumeration part as well as extensive kinship network enumeration. The Panel Study of Income Dynamics is particularly neat because you can look at very extended kin relations, including aunts and uncles and cousins and things like that. The Health and Retirement Study is also particularly important because it follows individuals at that critical life point, so you can look at things like do they get the help that they expect to get from different family members as they begin to need that help. And then the last one is the Fragile Families and Child Wellbeing Study, which allows you to study sort of issues related to mediation, because it has both measures from the caregiver as well as from the child's perspective. So you can look at changes for individuals as potentially mediated by the sort of embeddedness in the family network. There's also a lot of opportunities for kind of increased modeling efforts. There are other talks in the SNH workshop related to agent-based modeling, and I think there's a lot more that could be done to build in these family and kinship networks into agent-based models. Many agent-based models, I think, have a relatively naive concept of family networks, or perhaps even no concept of family networks, and there's a lot more that could be done to consider how persistent networks over time might change diffusion dynamics, changes in kind of support dynamics and things like that. If you are interested in conducting demographic microsimulation, the current one of the best sources to do that, there are others, but one of the best sources is the Berkeley SOCSIM program, for which I've provided the link here. And in the next couple of years, I'm hopeful that with people at Max Planck, we're going to release an R package for conducting that. And then hopefully, when I come back next year, if I'm invited back, hopefully we'll have some kind of different analytic estimates that could be useful, including age-specific kinship networks for all countries for over a long period of time, as well as incidence and prevalence of bereavement and under different circumstances at different kind of scales for the United States, which I think could inform a lot of other studies. So to wrap up, I wanted to discuss or to recap my talk and then make a final point. To recap my talk, I think that the social networks literature tends to emphasize friend and peer networks, and to some extent to de-emphasize family networks. But I think that there are really exciting and good reasons that we study family networks. There's great tools like ergom models to study friendship networks. But I think that family networks are also important, and we need to pay more attention to the way that they influence individuals' health, particularly at particular developmental stages. There's also clear classic and contemporary theoretical reasons to expect this, and the data really does bear out that family networks are central components of our social lives. Many important questions can already be answered about social networks and families, and I think that there's a number of ways that you could do that through survey data, through kind of modeling approaches as I've discussed, and despite the fact that there might not be as readily off-the-shelf available tools, I think there's a lot that can still be done. To conclude, I want to wrap up with the broader point that these family networks and their importance for health are only going to grow. If you think back to the empirical data that I showed about who we talk to, who we spend time with, who we get support from, all of those suggest that older individuals primarily rely on family members for those types of support. And the population of older individuals in the United States, in other countries around the world, is only expected to grow. And this is not going to be constrained to rich country, Western Europe, United States contexts, but it's going to be a global phenomenon in Latin America, in East Asia, South Asia, etc. The population of the world over the age of 50 is growing rapidly, and I believe that there's good reason to suspect that family ties are going to play a central role. And so my hope is that in the next decades, the percentage of social networks and health scholarship that looks at family ties increases from the 8% or 9% that we have today to better reflect the centrality of these types of ties in influencing people's health. So thank you very much for having me. I'm happy to answer any questions by email. My email was listed at the beginning of the presentation, and I should be available in the session that is dedicated to question and answer. Thank you very much, and have a great day.